Rate control versus rhythm control for atrial fibrillation after cardiac surgery. Background: atrial fibrillation after cardiac surgery is associated with increased rates of death, complication, and hospitalization. In patients with a postoperative atrial fibrillation who are in stable condition, the best initial treatment strategy, heart rate control or rhythm control, remains controversial.
Atrial fibrillation is a common complication after heart surgery. It is when the heart rhythm becomes irregular. Why it happens is really unknown, but is probably related to the inflammation that occurs inside the chest after a heart operation. It can usually be successfully treated with medical therapy. Every once in a while, a patient requires a cardioversion. A cardioversion is when a patient is put to sleep with an anesthetic for a few minutes and then an electrical shock is done across their chest to put the heart back in normal rhythm. However, in some patients it's a little more of a nuisance. On those patients we would treat with medicines as well as blood thinning, but by 2 months just about everyone is back in a normal heart rhythm.
Applications in medicine. Atrial fibrillation is the most common arrhythmia complicating cardiac surgery. Patients with developed atrial fibrillation following cardiac surgery are at increased risk of stroke, congestive heart failure, and hemodynamic instability. Postoperative atrial fibrillation is invariably associated with increased intensive care unit stay and prolonged hospitalization, and it is responsible for significant patient morbidity and health care expenditures.
Atrial fibrillation is and always has been the most common complication after cardiac surgery. The controversy about how best to treat postoperative atrial fibrillation has not been addressed in a big randomized controlled trial until now. The Cardiothoracic Surgical Trials Network conducted a study comparing rate control to rhythm control in people who develop atrial fibrillation after cardiac surgery. Rate control was achieved primarily with beta blockers, rhythm control with amiodarone with or without cardioversion. The primary endpoint of the study was the number of days in hospital from the date of randomization till 60 days post-randomization. Therefore, this endpoint included readmission. The trial finding was that rate control and rhythm control were equal for postoperative atrial fibrillation. No difference in hospital days, no difference in morbidity or mortality. One takeaway from this study, therefore, is that it is reasonable to treat postoperative atrial fibrillation initially with rate control. Begin the treatment of postoperative atrial fibrillation with beta blockers. If the beta blockers are not tolerated or unsuccessful, then switch to rhythm control with amiodarone with or without cardioversion. But rate control and rhythm control both work well. Rate control as an initial strategy avoids amiodarone-related toxicity and is generally successful.
Pros: at 60 days, 93.8% of the patients in the rate control group and the 97.9% of those in the rhythm control group had had a stable heart rate without atrial fibrillation for the previous 30 days, and the 84.2% and the 86.9% respectively have been free for atrial fibrillation from discharge to 60 days.
Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Do drugs that control heart rhythm or heart rate do a better job of treating atrial fibrillation? It turns out the answer to that question depends on when you ask, according to research published online ahead of print in the Archives of Internal Medicine. Here is some information about atrial fibrillation. It is a type of heart rhythm disorder in which the heart beats both rapidly and irregularly. Rhythm control drugs are used to return the heart to normal, regular rhythm. Rate control drugs are used to slow the heart down to normal rate. Researchers from the Harvard School of Public Health used a Quebec medical database to identify more than 26,000 individuals aged 66 or older who were hospitalized for atrial fibrillation between 1999 and 2007. None of the participants were taking medication to treat atrial fibrillation before they were hospitalized, but they were all prescribed such medication within a week of being discharged from hospital. After an average follow-up period of about 3 years, the investigators discovered that the survival rates of participants taking rhythm control drugs versus rate control drugs varied with time. Initially, survival rates were slightly higher among those treated with rate control drugs. Within 6 months, that difference disappeared, and the two treatment strategies appeared to be equally beneficial for 6 months to 4 years after hospitalization. Subsequently, survival rates gradually increased among those taking rhythm control drugs, such that there was a 23% reduced risk of dying in this group, compared with those given rate-controlled drugs at the end of 8 years of follow-up. Today's research suggests that there may be a small long-term benefit to treating atrial fibrillation with rhythm control rather than rate-control drugs. These findings are far from confirmed. Never make changes to your heart medication without first consulting your healthcare provider. For Insider Medicine in Depth, I'm Dr. Susan Sharma.
Cons: about 25% of patients in each group deviate from the assigned therapy, mainly because of drug ineffectiveness in the rate control group, or amiodarone side effects or adverse drug reaction in the rhythm control group.
After surgery, most patients have an eventful recovery. About 90% will go home within 5 or 6 days of their operation. But 10%, one in 10 patients will have a side effect that delays their discharge. The most common side effect is to get an irregular heartbeat or atrial fibrillation. This is like, it's not a dangerous heart rhythm, but like a car engine firing on half cylinders, you don't feel well, you feel tired, and you need to rest most importantly. The doctors and nurses will help the heart get back to a regular rhythm. May give you potassium via tablets or via a drip. They might put you on some extra medication to slow the heart down and restore a normal sinus rhythm. Very occasionally, the heart is resistant to going back into regular rhythm, and it may be after 2 or 3 days of trying medication, you have a small anaesthetic, a short general anaesthetic, and you have an electric cardioversion of your heart to get back into regular rhythm. If this shouldn't succeed, you might be discharged home with an irregular heart rhythm, but almost certainly it will revert back to normal by the time you see an outpatient.
Conclusion: strategies for rate control and rhythm control to treat postoperative atrial fibrillation were associated with equal number of days of hospitalization, similar complication rates, and similarly low rates of persistent atrial fibrillation 60 days after onset. Neither treatment strategy showed a net clinical advantage over the other.
Hi everybody, it's Adam, and we are coming to you from the AATS in Philadelphia. I'm thrilled to be standing next to Dr. Neev Odd, who is the chairman of cardiac surgery at Nova Heart and Vascular Institute in Falls Church, Virginia. You might recognize him from the patient reunions that he holds on an annual basis. It's a great thing that you do for the patients. And we have a question that comes in from Ted, and Ted writes, "Dear Adam, I had my aortic valve replaced. The new valve is a pericardial tissue heart valve, and I've experienced AFib after surgery. The question is, what causes AFib, atrial fibrillation, after surgery?"
Well, that's a very good question. Atrial fibrillation after open heart surgery in general and valve surgery in particular is a very common problem. With an incidence of anywhere between 20-22% to about 50%.
Wow.
And the etiology is not so clear to us and may go all the way from inflammation after surgery to some more basic mechanism related to heart function and parts of the myocardial cell function that we published heavily about in the past. So when patients experience atrial fibrillation after surgery, the big question is how long it takes for it before they convert back to sinus rhythm. If it's anywhere between a couple of minutes to a few hours, then we usually don't treat it. However, if it looks more sustainable and patients are symptomatic, we treat it with regular antiarrhythmic drugs. And if it goes for over 18 hours, we start anticoagulation. If antiarrhythmic drugs are not helping, then many patients do have to have electrical cardioversion. You can have anywhere between 1 to a few events, but the good news are that it's usually self-sustainable, and in 99% of the cases it just goes away as the time passes. So by 6 weeks the incidence is really minimal.
Right. Well, Dr. Odd, thank you so much for everything that you've done. I really appreciate it. You've been a great contributor to the site, really helped us educate all the patients out there and their caregivers. So thanks again for all that you do. You can learn more about Dr. Odd at heartvalvesurgeons.com. Keep on ticking.
Thank you.